images for Macy, and this was taken on yesterday. Her date of birth was the 22nd, which was 4 days ago, right? When she
23rd.
23rd, okay. So this was 4 days after delivery. And we know that this test is most sensitive in the first week. That's what it can really tell us the best. So as we go through the pictures, things that are bright on this image are areas of stroke. Things that are dark on this image are areas of stroke. So we correlate it to make sure that what we're seeing here is really double checked here. But these are images that show us areas of stroke in the bilateral cerebral hemispheres. So this is Macy sitting up almost image. You know, it's going through the back of the head and it'll come forward. You'll see the eyes. But anything that's bright, which you can tell is most of the tissue on this side is way too bright. That means those are areas that were hurt by a stroke, did not get blood, and therefore they're hurt. Now the cerebellum is looking okay. It's not bright, right? That's a very small area. Maybe some of these little areas weren't hurt so bad, but most of the bilateral hemispheres of the brain are hurt. The brain stem itself doesn't have much effect to it yet. And this is the frontal lobes. They were also very much hurt. And so what's dark here tells us also that area is definitely all stroke.
Is she going to be able to breathe on her own?
That's a very big question in my mind. I don't know. The brainstem, you know, the area, the lower part is the brainstem that connects to your spinal cord. It controls a lot of our heart rate, breathing, swallow. But the thing about it is, we really need our brains to kind of coordinate and be sensitive. Yes, the motor action is there, but you know, you need your brain to, you know, oh, there's a cup coming to my lips, now I need to swallow, or I feel the secretions, now swallow. Maybe you can, but there's a lot of higher coordination that helps us live. And that is not likely going to be there, very functional. Now, over time, it's not like, oh, these pictures, we just have to know these pictures. We'll watch Macy. Right now, she's had a lot of sedated medicine. The phenobarbital, the Versed drip. I'm going to pull the Versed drip away today. Take her off EEG because the seizures look controlled on the phenobarbital. So we'll do that, and we'll let her kind of come up from that sedation, and then we can truly see what she's going to do. That's also important. Okay, so I'll be here this weekend and through Monday. We'll watch how she's doing. We can talk about it again. This is not something you absorb in one sitting.
If she's not going to be able to breathe on her own, it would take away the vent, and then she's just going to die.
And the bigger questions are also with that, I would like you to consider not just breathing, but can she see? You know, your eyes may be okay, but can you interpret? Can you interact with any part of your environment? We need our brains for that, right? Can you sit up? Can you hold your head up? Can you move your body? That helps us be comfortable. Can you swallow so that when you have saliva in your mouth, you don't choke on it? So those are very basic but important things, and right now is not a good time to make decisions, but it's time to understand where we are. And that's going to take a few days, and the beauty of it is I'm here till Monday, so we can kind of have intermittent discussions. Okay.
May I ask a question?
Yes, of course.
Okay, so with the damages that you were showing us,
yes.
And what, if any, is there chances of any sort of repairs that are done to, like, just her in general with baby development and things constantly
Yeah.
changing?
Well, some areas don't look absolutely hit hard stroke.
Right.
Some areas. But when the bilateral hemispheres have stroked this severely, that's less of a chance for this idea of, oh, it's a baby. Some areas will take over what that
Right.
area did because both hemispheres were hit so hard.
Right.
So
Okay.
I think although there are some areas that have survived, there is such a extent of injury that will still be very difficult to have much recovery
Okay.
or support from other systems that could come in to help.
So will you do another MRI in a couple of days? Is that how?
It would probably in a month you would see the exact extent of damage and how much of the brain has died away.
Mhm.
That can also be seen on ultrasound. Other signs are going to be how she's doing. Other signs are going to be the brain is not growing. This baby's brains grow 3 centimeters in that first month.
Mhm.
Every month for the first 3 months is growing like 3 centimeters. And we do notice that it doesn't do that. Now, sometimes it gets filled with some fluid, so it does have some growth to it. But yes, we can repeat imaging. We don't want to do it too soon. We want something that reflects, okay, so what was truly damaged and what is gone now.
Mhm.
So at the soonest, that would be a month.
Okay.
But we may have more information clinically just from how she's doing
Okay.
in a month. So some of the frontal lobes look bilaterally. These areas which kind of smooth or help our movement less so had stroke, and then the cerebellum.
What all function is controlled by the cerebellum?
It's really speech is impacted. It's kind of a fine tuner of motor, speech,
Okay.
tone, like how you hold your head up, your body up, things like that.
Okay.
So I'll come back by and I'll just say, hey, do you want to talk? And you can say no when you feel like talking. And you can also tell